Guys, we are still talking with the Rose for Care Natural Wellness Center. Grace. You've met Grace before because we've been walking around here with her, and she's shown us around, and we kind of liked her, so we kind of kidnapped her. Also, she's very beautiful, and Rose just blew our mind because you said you have how many years experience again?
14 years.
That is a lot of years.
Yes.
I am shocked you even have, I don't know, I thought you probably, if you're you're probably 22, 23, but that's good. So you're a very seasoned nurse, and you are telling us about this place, what you do here. Yes. So can you just go through that again?
We do the services that we offer.
Yes,
we do
please.
the palliative care services. We also do respite care. We also do surgical care, where somebody has gone for a surgery and they need somewhere where they can recover, a very serene environment. We also offer that. We also do offer stroke services, people with the hypertension, and then they have gone into stroke. So we also take care of those patients.
Yeah.
Also cancer patients. We also provide nursing care at home.
Right.
There are some people who feel comfortable when they go with the nurses at home. We also do that, and also provide the caregivers. And we ensure there is a lot of documentation and all information they are confidential for the sake of the patient.
Right.
Yes.
Okay. And do you guys provide any kind of maybe education to family?
Yes, we do family conferences,
Right.
where we have to invite the family so that they can know the progress of the patient. Some family members, they may not know what is happening with the patient condition
Or even what to do?
or what to do. We are there to educate them, to empower their caregivers.
Right.
Some people, they have caregivers at home, so I'm there to walk the journey with them and make sure they have the adequate knowledge they need for that condition of a patient.
Okay.
Yes.
And I also noticed that you guys do hospital to home transitions, recovery support, and residential recovery care, because now this is, if somebody needs, pretty much, it doesn't matter what it is, they just need recovery.
Yes.
This is a very safe place for them to come. Do you guys work with people who have mental illnesses and they need care?
Yes, we also do that because sometimes some mental illness can be very demanding. So we also work with that and
Right.
also provide counseling because those also the family members, they need someone to talk to.
Okay.
As well. Yes.
Yeah, because that's another thing I've noticed. A lot of women in the US have kids here who they have special needs.
Yes.
And you know how those kids are treated in the communities.
Very true.
Yeah, so if maybe somebody is mentally ill and they're able to cope with medications, they will need help. You know, that place like here where they get, because nyumbani nobody even takes them for treatment, nobody takes them for checkups, nobody reminds them to take medicine. Kids go, you know, they what do you call behaviors
They're
start
hyperactive.
that.
Sometimes they will become like they're stressful to the parent.
Right.
So we are there to
Right.
take care of that because as a nurse, our work is to ensure that family members and the patient is comfortable. That is why we are here for, as those for care.
Okay.
Yes, and also we also provide ambulance support. In case of any emergency, you're well taken care of. We have doctors and nurses that are qualified to ensure that emergency cases were taken care of.
Okay.
And we hope, and we believe by the grace of God, the prognosis will be well.
Oh, okay,
Yes.
okay. And that explains why there's hospitals.
Yes.
Those are good hospitals. Aga Khan.
Aga Khan,
Yeah.
Hospital,
Nairobi. Yeah.
MP Shah Hospital, those are good hospitals. That
Yeah.
are good. Yeah.
Okay. Is there anything else you guys do here that we need to know about?
Yes, we also have medical tourism support where we
Yeah.
can be able, maybe there is a parent who's in a certain country, we can be able to pick them, maybe like US when it's the cold season. We can be able to go pick for them and come with them in this nation and also take care of them. Also, we are able to provide some extra, like take them to Masai Mara parks when they have a nurse or a caregiver, so that in case of anything, we are there to do that. So we also provide those services.
Oh, okay. And say somebody's sick and they want to do that medical tourism thing, do you guys support with anything like visas, whatever, or they do that by themselves?
That's why we organize with a company, and there is a way that we get those documents. ready.
Okay.
Yes.
So this is also where so while we're here talking about medical tourism, say I want to come down here for, plastics.
Yeah.
Do you guys offer that kind of support?
Yes, we do. Women, they like being beautiful.
Yeah.
And they also need somewhere where they can just rest and heal and get their attention.
Yeah.
So at
The
rest
recovery
and
homes.
recovery,
Yeah.
yes, where the nurses are there to avoid infection,
Yes.
to ensure they are well taken care of. It's like a staycation that is a healing process.
Yeah.
So we are there to do that, and we are there also to ensure privacy, because there are some things that they also need privacy.
Yeah.
So we ensure that there is a lot of professionalism done, and you go back with good results.
Yeah, hey, that's important. There was a time a lady went for some kind of surgery and took a friend to take care of her in the hotel room, and oh my God, we heard about it. It was so public. Oh, you got BBS? No, it was tummy tuck. Oh my God, it was so embarrassing.
So at Rose Care, we make sure there is a lot of confidentiality concerning your services.
Yeah.
And everybody
never
will
know.
think you know your.
Because it's none of our business.
Yes, very true.
Yeah.
And it is your right to be beautiful as a
Yes.
woman.
Yes.
Yeah.
Oh, okay. Now tell us a little bit about corporate wellness.
Okay.
What's that?
Corporate wellness is where we go to the bank or to corporate centers to speak or to tell people about their health awareness. There are people who are walking with hypertension and they don't know, or they're ignoring some symptoms. Like hypertension, you don't experience any symptoms.
Right.
So sometimes you can be having a headache and you're like, you just take some water and it goes. Usually if you had that diagnosis or that awareness earlier, you could have taken some action needed.
Right.
So we go there to do health talk, to create awareness on these chronic diseases like diabetes, on diet management, on when you need to visit a doctor. So we do all that. And also emergencies. At corporate, there are also some emergencies that can come. So we are also going there to give a health talk on how to have a safe occupation.
Oh,
Yes.
okay. That's really awesome. Is this some kind of CSI, or the corporations hire you to give this service, or you guys just donate your time?
Sometimes, most of the time, we'll go and donate our services to them.
Okay.
Because this is how we're also going to market our brand
Oh, okay.
and ensure people they know what we're doing.
Yeah,
Yes.
that makes sense.
Yeah.
Oh, okay. And community group wellness sessions. Yeah. What's
So,
that?
Okay, community wellness session is where people with, for example, people who have different diseases or different conditions like hypertension.
Yeah.
You don't need to work alone in that phase. You need some people to also help you work with that. So this is where we're going to create a group with the people sharing the same condition. For example, people with cancer. We work with them,
Yeah.
and also we make sure that we teach them, we walk through the journey, we educate their family members, and we do a lot of health checkup every time they visit us.
Yeah, it
Yeah.
makes sense that if you guys are on the same situation, you probably have a community where you can talk about what you guys are going through, and it helps, right?
Yeah, it helps.
It's very sad to have something like cancer alone.
Very true.
Oh man.
Yeah. So
Okay.
where we can provide the mental support, social support, and spiritual support as well.
Okay.
Because when it comes to recovery, it's a holistic care. Yes, not just physical. Some people they need social,
Right.
spiritual support, and we get to do that where we involve
Okay.
even the chaplain to pray for people,
Okay.
especially patients.
But that pastor doesn't work here, right? The one from outside. He said I have a big cross. Oh, that's so funny. So, Mommy, blood sample collection, it's very, very self-explanatory, but I have a feeling that maybe there's something, that we can learn from there. So you guys, how does this work
This is
with your clients here?
with our clients.
Yeah.
We are working with the laboratories where they come and take the samples. For example, if you need to know about diabetes,
Right.
we just do a random test that will not give us a clear indication that you have diabetes. So there is those tests that we do, and we take them to the lab we wait for the results, and then they come back, we give the patient the results, so that we can be able to also to know what else are we having, and maybe there is a silent disease that you have, and maybe you don't have, you don't know. Maybe there is someone who just come for just checkup, general checkup. We're able to take your samples and also give you the feedback after we get the results.
Okay, and is it only blood? Because there's many other different types of samples out here that you only do blood.
We for now we are just doing blood. Okay. Maybe when we keep on growing, there are other tests that you're going to involve.
Okay.
Yes.
All right. Oh, that's really cool. So I had Rose say that there's doctors here on call. Yeah. So could you just say a little bit how that works?
Okay.
Yeah.
So we are working with our doctors in case of emergency, because there are some things us as nurses we are not supposed to do. So the first thing after the triage, the doctor is there to assist the patient, to check the patient how they are, and also to check on the drug treatment, because that is their work. And in case of emergency, especially when you're dealing with these people with chronic illness, there are people that anything can develop at any time.
Yes.
Maybe someone with heart condition that they need like CPR, there is someone to handle that.
Yeah.
Yes.
Okay. Thank you so much. And you said you're a charge nurse.
Yes.
Yeah, that is, we are proud of you, because being a charge nurse is not just something that happens overnight.
Thank you.
Yeah. So thank you so much for hanging out with us and educating us about this place.
Thank you so much.
Yeah. So Kate, why do I call you Kate? Grace. I'm bad with names. I'm sorry. I only know my name and my mom's name.
Yes.
Thank you so much.
Iko sawa?
Yeah, iko poa kabisa. You've done good. So, mommy, hey, I don't even know. No, you should introduce her to us, because we don't know you while you're here. You're trying to crash our party. Yeah. So you want to introduce her? It just be like we actually have one guest from, what do you say, from the diaspora.
Actually, you would want better. If you go to the reception, you see somebody sits there. I come in the door, and I'm like, "Is this Rose?"
That's gonna take us way back, because we already. It's like that is totally acting.
Oh.
Just come.
Okay.
Yeah, she'll just tell me that she's.
One of the
Yeah, she came in to inquire, and she's from the US, right?
Rose services.
Yeah. And then you can just come and sit here, and then we do this. Yeah. Yeah. So just introduce her as she comes.